They're just gonna show up at our door now. Oh, there's nothing.
Hi, I'm Christy, the new grad nurse. Do you have a report?
Hi, yes, I have Mr. Smith for you.
Okay.
Okay, are you ready?
Yeah.
Perfect. So Mr. Smith, he's a 51-year-old male. He's full code and ×2 assist. He was admitted 2 days ago. He had an emergency surgery for bowel resection due to colon cancer. Currently, he has 5 lab sites on the abdomen covered in steri strips. He does have some dried serosing fluid noted there. He is currently on 2 liters of oxygen, starting at 94-95%, otherwise vitally stable. During surgery, he went into AFib. He's currently asymptomatic, but he's still being monitored on the tele. Right now, he has an NG tube. I've emptied 400 cc's overnight with bilious drainage. He has a Foley catheter that I've emptied 800 cc's of amper urine overnight.
Oh my goodness, I don't know how I'm gonna write all of this down. I feel like I'm missing something. Oh my god, this patient has a lot going on. I don't know how I'm gonna do this. I hope the staff on the floor today is able to support me. I feel so overwhelmed. I can't do this.
Cc's per hour. He does have sugar checks every 2 hours, and he does have a standing dose of insulin. Pain currently is being managed with PRN Hydromorph IV and 2 milligrams, and so far it's been on the every 2 hours that I've been needing to give him the pain meds. Last dose was given at 6 o'clock this morning. He did ambulate yesterday twice using a high wheel walker, and the last thing is the family wants a phone call update once rounds are done. And that's it.
Okay. Yeah, it's just very overwhelming. It seems like this patient has a lot going on, and I don't know how I'm gonna do it.
So you'll have great supports during the day, and you can always ask other nurses and the charge nurse for any more details, okay?
Okay, thank you so much.
Alrighty.
God, I feel so overwhelmed. She looks like a nice nurse that could help me. I'm gonna go ask her. Excuse me. Hi. My name's Christy. I'm a new grad nurse. I was wondering if I could get your help with a patient. They just have a lot going on, and I don't feel comfortable. Sorry to bother you. I see that you're busy. I just don't. I don't feel comfortable with certain things, and I was wondering if you could assist me in looking up the policy for oxygen therapy, because I haven't done this before, and I just need.
You really don't know how to do that. How are you even hired if you're gonna be so incompetent? Go go to someone else. I have my work to do.
Okay, sorry.
Admit the poor girl cry. She's really not cut off for this. Pathetic.
Here we go again. It was Flora speaking.
Hi, Flora.
Hi.
How was the shift?
Good.
Okay, so there were some issues that was brought to my attention. There was a situation that occurred yesterday between yourself and Chrissy. I'm gonna ask you to come down to the office at approximately 1:30. I did arrange for coverage for you. Okay, yes, I'll see you then.
All right. See you then.
Hi, Flora.
Hi.
So, Flora, I want to address an incident of horizontal violence that occurred recently. That happened between yourself and Nurse Christy. I just want to tell you that here at TMU Hospital, we have a zero tolerance policy for horizontal violence, okay? So it is crucial that we maintain a supportive and respectful workplace environment for everyone's well-being. So the incident involved behavior that was inappropriate and had negative impact on our team. I encourage you that you reflect on your actions and consider any underlying factors. I'm going to give you an explanation as to what horizontal violence is. It refers to an act of aggression, intimidation, or underlying behavior from one colleague to another. There's different types. There's verbal abuse, there is nonverbal gesture, exclusion, and sabotage. So recently we had an in-service and it did speak about the micro, the macro, and the meso level of horizontal violence. But I just want to recap on it again, okay? So the micro level, it's about understanding individual experience of horizontal violence and its immediate impact on the nurse's well-being. At the meso level, it's exploring interpersonal dynamic and the nursing within the nursing unit and the teams that contributes to horizontal violence. And at the macro level, it's about examining systemic factors contributing to horizontal violence, such as culture, leadership dynamics, and staffing policies.
And you do know that Christy is a new grad nurse, and evidence does suggest that new grad nurses are more vulnerable to experience bullying and violence within nursing professions. New grad nurses might expect but do not always receive the support during their transition and can experience bullying and violence. The level of skill and competence of RNs creates a hierarchy of nurses that is reinforced in the hospital setting, which fosters comparisons between RNs and contributes to conflicts in the workplace.
Please, Flora, know that we are just following the recommendations from the RNAO. That as a health service organization, we have to implement appropriate policies and code of conduct to address harassment and bullying in the workplace and learning environments. As former leaders in this health service organization, we have to be actively involved in preventing and addressing harassment and bullying to support health workers and students by understanding and reinforcing policies that address harassment and bullying and providing mentorship and role modeling of professional behavior.
Started or you did playing basketball too?
Okay, good morning everyone. We're gonna have an in-service about horizontal violence. As you know, nurses have the highest rate for bullying and horizontal violence, and that's from a study done by Al-Shawash in 2020.
And in terms of the cultural considerations, new grad nurses are the most vulnerable to experience bullying and violence within nursing professions. And new grad nurses might expect but do not regularly receive support during their transition and can experience bullying and violence.
Prevention is crucial to stop lateral violence. According to the CNO, nurses can promote a respectful work environment by modeling professional behaviors. Besides that, nurses should also acknowledge that personal stress can impact professional relationships and act proactively to manage stress. Using good communication, mutual acceptance, and understanding help create positive collegial relationships.
So some of the impacts from horizontal violence, we have high turnover rates, low work morals and job satisfaction, and even decreased patient satisfaction.
One note that we can considerate is that nurses, for example, can address conflict directly rather than postponing its resolution, according to the CNO. And they can also collaborate with colleagues to identify underlying causes of the conflict.
Good morning, Christy. Can I talk to you for a minute? How are you today?
I'm okay. I'm still a little bit upset about yesterday.
I know I was really out of line yesterday. I shouldn't have snapped at you like that. I was feeling really overwhelmed yesterday. I'm truly sorry.
Thank you for apologizing. I really appreciate it.
I know. It wasn't fair of me to treat you like that, especially on your first day of work. I promise to do better and support you from now on.
Thank you so much. That means the world to me.
Thank you, Christy.
That is 12 months.